Hi, I'm Dr. Pill. Today we're going to have amoxicillin on the show to tell us about a little bit about herself and how she works. Everyone, please give amoxicillin a warm welcome to the Dr. Pill show. Hi Amoxicillin, welcome to the show. Is it okay if I call you Amoxicillin?
Well, my real name's actually Amoxil, but all my friends call me Amoxicillin, so that's fine.
Okay, well, tell us a little about yourself.
Okay. I'm a penicillin antibiotic, and I actually kill off different types of bacterial infections in the human body.
Oh wow, okay, so who are you made by?
GlaxoSmithKline.
So what would you say some of your side effects are?
Well, some of my normal side effects are nausea, vomiting, and diarrhea. But I do have some more adverse side effects like bloody stool, confusion, fever, chills, stomach pain or cramps, seizures, and I have some pretty bad allergic reactions.
Okay, well why don't you tell us some more about some of those allergic reactions?
Well, anyone who's allergic to any type of penicillin should not take amoxicillin. My allergic reactions include rash, hives, itching, difficulty breathing, the tightness in the chest and your throat swelling up, and the swelling of your mouth, face, lips, or tongue.
So how would you say you interact with other drugs?
Lots of times I'm prescribed with clovanic acid. It's a beta-lactamase inhibitor because I'm susceptible to beta-lactamase degradation, and the acid helps with that. But some adverse interactions I have with other drugs are with oral anticoagulants, oral contraceptives, probenecid, and methotrexate. I can usually either I affect the way that those drugs work, or they affect the way that I work, but we don't usually get along.
So what would you say your primary route of administration is?
Well, mostly it's oral, but it can also be intravenous. But I come in powder for solution, powder for suspension, tablets, capsules, syrups, all kinds of things.
So what's the molecular mechanism that makes you therapeutic?
Actually, I act by inhibiting the synthesis of the bacterial cell walls. I inhibit cross-linkages between the linear peptidoglycan polymer chains that make up major components of the cell walls of both gram-positive and gram-negative bacteria.
Well, why don't you tell us about some of maybe the issues and some of the benefits you have with patient compliance?
Well, the biggest issue that I have is lots of times after people start taking me for a couple of days, they start to feel better and they don't finish their prescription. And I act to my fullest extent if I'm taken for the whole prescription. One of the benefits I have is I'm relatively inexpensive. Most prescriptions are $25 or less to take me, and my dosage depends on people's age, weight, and the type of infection and bacteria that they have.
Okay, well why don't you tell us a little bit about your safety?
Well, I actually have a very high therapeutic index, which means I'm relatively safe because that means that the benefits that I have outweigh the risks. The only thing that my patients need monitored for is for allergic reactions because penicillin has a 10% rate of allergic reactions in its patients.
So what are some of your medication errors when you are prescribed?
Well, antibiotic resistance is becoming a big issue in our country, and that happens a lot when I'm prescribed. It either happens if a bacteria has formed a resistance to me, or if I'm prescribed too often, or if I'm prescribed for a viral infection or something else that's not a bacterial infection, so I'm not effective.
So, amoxicillin, what's your onset of action?
Within 2 hours of administration.
Okay, and then what would you say your duration of action is?
8 to 12 hours, depending on the dosage.
All right, and then maybe a little bit about your half-life?
It's approximately 61.3 minutes, and approximately 60% of what's orally administered is excreted through the urine within 6 to 8 hours.
Okay, so then what's your steady state?
It takes approximately 5 doses for me to reach a steady state.
All right. And do you require a loading dose or a maintenance dose at all?
Some dosages may require a loading dose and then smaller maintenance doses, but that just depends on the infection and the bacteria.
Okay. So are you directly administered into circulation?
Actually, yes, I am. I am rapidly absorbed after oral administration, and I diffuse readily into most body tissues and fluids.
Well, amoxicillin, thank you for coming in today and sharing a little about yourself. It was a pleasure meeting you.
Thank you. It's a pleasure meeting you too.
All right, let's give amoxicillin a round of applause.